Hi guys, welcome back to the channel. Dr. Gillard here. Today I am going to show you my stretching routine. And I think this routine is magical, at least for me it was, because it has tremendously helped me improve from a situation where I thought I would never get any better. In fact, 4 years ago, I was on Stanford's waiting list for a spinal cord stimulator, secondary to a failed back surgery I had in 2003. But for the last 3 years, I've been getting better and better. And last weekend, I did an 8-mile hike. I usually don't go more than 4 miles, but I got lost. I had a 20-pound backpack on, and I did an 8-mile hike over 2,000 feet of climbing. And I thought, oh my gosh, I'm going to have a horrible flare-up. I feel fantastic. So I thought, you know what? These stretching exercises are magical. I better put them out there. My coaching clients are asking me about these all the time anyway, and I've been promising them a video for a long time. Well, I finally got to it. Let's check out my stretching routine. But before we do that, let me do a little commercial here for my coaching business. If you want to speak with me via Zoom with regard to your chronic low back pain or neck pain or sciatica or radicular pain, send me an email and let me know what's going on. I don't take everybody, but select members of the public I do speak with, usually those who have had pain more than 6 months and are on the fence whether or not they should have surgery, or they've had the surgery and it's failed. I have a really good track record at pointing people in the right direction in that regard. So send me an email and let me know what's going on. I'll let you know if I can help you or not. All right, let me show you my stretching routine. All right, guys, every morning I come out of that bedroom door and I sit my butt right here on the top step, and I will not go any further with my morning routine until I do these stretches. It doesn't matter if I'm late for work. I'm going to go through these. They take 10 to 15 minutes. So the very first thing I do is I bend forward, and you can see my butt's on the top step. My feet are on the 2 steps below, I guess that would be. First thing I do is I bend forward very slowly. I can already feel my back tightening. And the minute I feel a little bit of tightening, I stop. I'm not trying to set any records here. The first stretch is just kind of a warm-up. I have the weight of my trunk supported by both of my elbows here on my thighs, because I don't want to let the whole weight of my body push down. That's going to be stretching things I don't want stretched. And then I count to 25, 1001, 1002, 1003, 1004, etc. Then I go backwards very slowly, and I extend my legs all the way out, extend my knees, and I stretch it out this way. I'll push my shoulder blades together to help stretch my shoulders out. I'll hold that for about 10 seconds, and then I repeat. I'm going to do 3 sets of 25 on each one of these stretches I'm going to show you. So let's go again. 1001, 1002. I went a little farther this time. 3. I can feel it pulling right in my left butt, and that's far enough. And I would go up to 25. I've already done my morning stretches, so I don't want to overstretch because that can irritate my sciatica. You don't want to do this more than once a day. Then I go back for about 10 seconds, and then I repeat. All right, so 3 sets of 25. Then I'm going to do a little bit of an oblique stretch. So be very careful with this, especially if you've had surgery. You have to go really, really easy. And I have a bad knee, and so I'm using the wall here to support my knee. So I'm going to scooch a little closer to the wall here. I'm going to bring my heel up to the step right below my butt, and I'm going to put my knee up against the wall. My shin bone here should be about 45 degrees to the plane of the stair here. So that's about a 45-degree angle. And very, very carefully on this one, I'm going to, there's my foot, there's my shin, I'm going to push my hand right between these two, maybe right across the top of my ankle. Really slowly, I already feel it pulling, so I'm not going to press it anymore. 1001, 1002, 1003. I would go up to, I usually count by 4s, 1001, 2, 3, 4, 5, and then repeat. 1, 2, 3, 4, 2, 1, 2, 3, 4, 3, 1, 2, 3, 4, 4. Okay, and I feel that stretch. When I'm done, I extend my leg and knee, just kind of shake it out a little bit. I go on to this one. I got a bad hip on this side, so I have to pull up to help my hip out. This one I don't, my knee is fine. But what I do is I take this part of my arm right here and I put it right up against here, and it kind of acts like a stabilizer or a wall. I don't know if you can see that good with a camera, but I have a lot of weight going right on my wrist. Now, if you have bad wrists, talk to your doctor. Don't do this thing. But there, now I'm set up. My heel's on this first step, and I go right between my foot and my shin, kind of right across my ankle, really slowly. One. This is my sciatica leg, so I have to be careful. It actually stretches better than my other leg because of the muscle loss I have in it. 1, 2, 3, 4, 5, 1, 2. So it doesn't matter how you count. Count up to 25 seconds and just hold it and concentrate. Don't overstretch. Okay, shake it out. And then we just repeat it. Okay, I'm going to do one more because I'm a little tight. Okay, so this time I'm going quite a bit further. And I know how far I can go. When I can touch my pisiform, that little bump on your wrist right here, when I can touch my big toe with that, that's all the farther I want to go. Or when I can put my whole hand around the corner here of the step, I'm good. I don't want to stretch farther than this. I can, but I always flare myself up if I go too far. So this is like the maximum I can go. Great, I'm pretty well stretched out there. And then let's repeat on the other side. Let's see how that's doing. See if I'm ready to go out, go for a hike or whatever, or go off to work. I got my whole hand around the step, and this is going to be different for you. Take my pisiform to my big toe, and this is all the farther I need to go. All right, guys, that's it with those stretches. Now, I also like to stretch out my knees. So I will put my heel up on this top step and kind of pull it back and very slowly push my body down to my knee until I feel a stretch in my knee. And I can feel my knee stretching very gently, guys. You can't overdo it with these things. Again, talk to your primary health care provider. Maybe you need an appointment with a physical therapist or a chiropractor to show you how to do these. All right, then shake it out a little bit. And then let's stretch this knee out. And I just kind of moving my butt toward my heel. I feel it starting to pull just a little bit. Don't overdo it. Don't overdo it, and just hold it. I can feel a stretch in my soleus and my gastrocnemius, or stretch in my calf. Great. And I do that. I don't do that as much. Maybe one set of 15 or something like that. And then finally, I reach for the sky. I'm going to try to stretch my thoracic spine out a little bit, like you're reaching or you're Superman, trying to touch the ceiling with my fingers. I hold that for about 5-6 seconds or so. And then very slowly, I laterally flex. Hold that for 5. I got to be careful with this because my sciatic nerve is encased in scar tissue. But it's good for my thoracic spine. Great. Hold that about 5 seconds. Or I don't do this for 25 seconds, but just a little stretch there. All right, guys, that'll do it. I hope it helps. If you have any questions, shoot me an email, chirogeek@chirogeek.com. Be happy to answer any questions you have. Don't forget, if you want to speak with me, just send me an email. Let me know your story, and I'll let you know whether or not you're a candidate for my coaching service. All right, guys, see you in the next video.